Hi, I'm Jessica Buzlog, and I'm gonna do oral medication administration skills video for you today. I'm gonna start by verifying the provider's orders. I'm gonna also verify the 6 rights of medication administration. I'm gonna ensure that I have the right patient, drug, dose, route, time, and documentation. I'm going to pull up my medications out, and I'm going to lay them here. And I'm going to pull up the MAR and go over the orders against the drugs and in the MAR. Okay, I'm going to do any dosage calcs at this time as well if I needed to. All right. So today the doctor has ordered 100 milligrams of Colace, PO, and that's 1 tablet. 5 milligrams of Coumadin, PO, and that's 1 tablet. 20 milligrams of Lasix, and that's also 1 tablet, PO. And 20 mil equivalents of potassium chloride, and that's PO, and that's also 1 tablet. We have 500 milligrams in 15 mLs of acetaminophen, and this is liquid suspension. Okay, I'm going to gather all my supplies, and I'm going to enter the patient's room. I'm going to do hand hygiene. I'm going to close the door behind me for patient privacy. I'm going to introduce myself. Hi, Mr. Smith. My name is Jessica. I'm your nurse today. I need to just get your full name and your date of birth, and I'm going to compare that to your wristband to get 2 patient identifiers. He says his name is David Michael Smith, and his date of birth is 8/18/73, and those both check out on the wristband. Okay, Mr. Smith, I'm also gonna, before we get started, I want to ask you if you're allergic to any medications, any foods, or any environmental allergies. No? Okay, great. Okay, I'm gonna pull up the MAR, and I'm going to do a third verification, okay? We're going to go over the medications that your doctor ordered with you in just a moment, okay? So I'm looking at the MAR and at my drugs, and that's my third verification, but I'm also noticing that because I'm doing Coumadin or warfarin, I need to get Mr. Smith's INR. I'm going to make sure that that's within the acceptable range for warfarin. Anytime we give that medication, we need to do that. Also, because we're giving acetaminophen, we need to get a pain scale between 0 and 10 for Mr. Smith, as well as a temperature for Mr. Smith. Anytime we give acetaminophen, we need to do that. Since I'm asking for those 2 things, I might as well get a full set of vitals for him, and I'll go ahead and do that too. All right, I'm going to do hand hygiene again, and I'm going to don clean gloves. Okay, Mr. Smith, when I give you these medications, do you want them all in 1 cup, or do you want to take each pill separately? You want them all in 1 cup? Okay, I can do that for you. Okay. Let's get all situated here. Gotta be careful we don't spill these. All right, I'm gonna start with the Colace. It's a laxative. It's a stool softener. Okay, it prevents constipation. All right, be carefully there. Some of the side effects are nausea and vomiting and diarrhea. Okay, some people get a bitter taste in their mouth. All right, some of the adverse effects are going to be abdominal cramping, sorry about that, or a rash. So those adverse effects I need to know about right away. Let me know if you have any of those symptoms. Do you have any questions about Colace? Okay, great. The next one here is going to be your Coumadin or warfarin. Okay. Coumadin is a anticoagulant or a blood thinner. So that's used to treat or prevent blood clots. Okay. And some of the side effects with warfarin or Coumadin are going to be bleeding, easily bruised, or joint or muscle pain. But some of the more concerning adverse effects are going to be bright red stools or dark tarry stools. And also another adverse effect would be dizziness upon standing. So that I need you to report back right away if you have any of those symptoms. Do you have any questions on the warfarin or Coumadin? Okay. Next up is your Lasix. Okay, and this is a loop diuretic or a water pill, it's sometimes called. And this is going to help edema or swelling. And some people who have congestive heart failure or kidney or liver disease have edema or swelling that they need to treat. Okay, some of the side effects of Lasix are going to be urinary frequency. Because your body's getting rid of all that fluid, you're going to have frequent urination. It's expelling a lot of that water out. That also causes some constipation in some people. Some people have reported blurred vision. Okay, some of the more adverse effects are going to be chest pain, shortness of breath, okay, muscle cramps, and weakness. So I need you to let me know right away if you experience those adverse effects. Do you have any questions about the Lasix? Okay. And your last one here, all right, is going to be your potassium chloride. Okay. So potassium chloride is an electrolyte, and we typically give this with the Lasix. We want to keep your potassium levels normal. We don't want you to get too low, okay? Some of the side effects of potassium chloride are nausea and vomiting, diarrhea, upset stomach. But the adverse effects for this one are irregular heartbeat, tingling, or severe stomach pain. So you need to let us know immediately if you have any of those. Do you have any questions on the potassium chloride? Okay, great. So this is acetaminophen or Tylenol, and this is for to treat fever or pain. It's a pain reliever, fever reducer. Okay, and let me see. Some side effects of Tylenol are going to be, let's see. Give me just a second. Constipation or vomiting. Let me see. And the adverse effects would be dark urine or a decrease in urine, or any abnormal sweating or yellowing of the eyes. I need you to let us know right away on the adverse effects there as well. Do you have any questions on the Tylenol? Okay, we have 500 milligrams in 15 mLs that your doctor's ordered, okay? I'm going to just make sure and look and make sure there's no sediment here and keep these on a flat surface. I'm going to keep the cap upright. Okay. And I'm going to, on a flat surface, just pour 15 mLs. I'm just gonna wipe the lip and the neck of this bottle. Okay, make sure there's no drops or anything like that. I'm gonna recap that. All right, Mr. Smith, I'm gonna assist you to take these tablets first. I have water or juice for you to get those down. Okay. Let me just show this is 15 mLs of the Tylenol. Make sure I'm not tilting that there. That's okay. And I can go ahead and take that. And I can give you water or juice for that one as well to get that down. I'm going to go ahead and discard all my trash, all my medications. These wrappers, we can also verify again with the MAR, make sure these medications were correct. I'm going to discard those now. I'm removing my gloves. Okay, I'm going to do hand hygiene. I'm going to lower your bed down, Mr. Smith, to the lowest level for your safety. Put any side rails up if needed. Make sure your call light's within reach. I'm going to go ahead and close the curtain, and I'm going to hand hygiene again. I'm going to go ahead and chart my procedure. I'll be back on and check on you in a little bit, Mr. Smith. And just for verification, I used MAR number 1 for this video. Thank you.